Community nurse home care patients have different needs, and for those living with unstable conditions like congestive heart failure or chronic breathing problems, small changes in health can act as warning signs. Telemonitoring helps our patients avoid setbacks and stay out of the hospital. The monitors are simple to use, and in-home hands-on training is provided by us. Each day, a patient records and securely transmits vital data to a nurse, and if we don't hear from a patient, we will contact them.
Good morning, Mr. Souza. This is Heidi with Community Nurse. How are you feeling today?
If any warning signs are noted, the nurse will start a live video chat with the patient to decide how to proceed, and the doctor may recommend further care. Families and physicians are comforted to know health is being monitored and changes will be addressed promptly.
Great. I'm glad to see that we got you feeling better and back on track. Feel free to give me a call at any time with any questions or concerns. Thank you. Have a good day.
Telemonitoring is one of the many services we provide that are not funded by insurance. Community Nurse Home Care is a 501c3 not-for-profit agency, and we depend on the support of community members like you so we can all work towards the goal of living well. After discharge from nursing care, you can turn to our Care Transitions Call program for encouragement and help. Our bilingual community health worker contacts you regularly to ensure that you are continuing to live well. She will reinforce the healthy habits you've developed and connect you with resources to meet unanticipated needs.
Boa tarde, senhora. O meu nome é Vanessa. Estou chamando da Community Nurse Home Care. A senhora está boa?
One of our patients' biggest challenges and fears is loss of mobility. For one patient, our community health worker assisted him with getting a rolling walker, bolstering his confidence, securing his independence, and his ability to live well. For another patient, whose healing depended on proper daily nutrients, she arranged a consultation with our registered dietitian, who recommended an Ensure supplement. We were able to provide the Ensure through the Community Nurse Comfort Fund until long-term resources could be activated.
Sim, estou bem, obrigada. Encontrei lugar que pode consultar seu CPAP. Eu posso dar à senhora mais informação?
Care Transitions Calls are one of the many services we provide that are not funded by insurance. Community Nurse Home Care is a 501c3 not-for-profit agency, and we depend on the support of community members like you so we can all work towards the goal of living well. Receiving a serious diagnosis can be a time of confusion, resetting priorities, and critical decisions. With Community Nurse Home Care's palliative care consultation program, you and your loved ones will meet with our nurse practitioner to help you understand your condition, treatment options, pain control, and side effect management.
Good morning, this is Erin, the nurse practitioner with Community Nurse. Yes, Vanessa, our community health worker, asked me to reach out to you today. I spoke with your doctor and she wanted me to speak with you about your heart disease. Are you available to meet with this afternoon?
Research shows that when we have a palliative care consultation, outcomes are better. In his book, Being Mortal, Atul Gawande says the goal of palliative care is to create the best possible day for patients today. Our palliative care consultations afford you and your loved ones the time to discuss the possibilities which accompany life-limiting illness and formulate a plan defined by your goals for living well.
Has your mom talked to you about our goals as she's getting older, about whether or not she wants to stay home or move to a nursing facility?
We have talked some about that, and I know that her independence is really important to her, but that she doesn't want to become a burden to us, and her faith is also really important to her, so we really need to know what our options look like. If you're coping with serious illness and don't know where to turn, contact Community Nurse Home Care.